Okay. Knock, knock. Hi, my name's Josiah. We're going to do a head-to-toe assessment today. Okay. Wash my hands. I'm going to put on some gloves and we'll get started. Okay, so we're going to get a quick set of vitals. Blood pressure, for the sake of time, pretending like that's done. I'm going to put an SpO2 on you and check your pulse here. Okay, good. Pulse is nice. Waveform looks good on the SpO2. I'm going to say that I actually listened to or felt her pulse for 30 seconds. Her respirations are 16 to 18, which is normal. Very good. All right, we're going to start by taking a look at your face here, your eyes, ears, mouth, and throat. Okay? So I'm just going to look at your face here for symmetry. Face looks very symmetrical. I'm going to take a look at your scalp here, feeling for masses or lesions. Good, everything feels good. I'm going to feel the back of your head here. I'm actually looking for lymphadenopathy, which is enlarged lymph nodes. I like to come down on the clavicle side. Good, I don't feel anything. Just taking a look at your ears. The top of the pinna is in line with the canthus of the eye there. Very good. So I'm going to palpate around your ears here. On the pinna and the tragus, any pain there?
No.
Mastoid process?
No.
How about back here? Any pain?
No.
Okay, mastoid process, good. Okay, can you give me a big smile? Good, a frown. Close your eyes real tight, open up, and there you go. So what we just looked at is cranial nerve number 7 for checking the face. All those motor functions look good. I'm going to have you close your eyes. I'm going to check cranial nerve number 5 for sensation. Let me know what you feel.
My left cheek.
Okay, very good.
Right forehead.
Good.
Right cheek.
Good.
Left temple.
Very good. So cranial nerve number 7 is intact. We're actually checking cranial nerve number 8 right now, just talking. Okay. I would like to look in your ear. Turn this on. Okay. So I'm pulling up on the pinna. Good. Let's check the other side. Good. So there's no redness, erythema, swelling, no signs of fluid effusion. The light reflex is where it should be, and the tympanic membrane is pearly gray. Very good. So we're going to check your eyes here. I'm going to shine a light here. Your eyes. So we're going to actually check the red reflex, so look straight ahead. Very good. Other side. Good. So the red reflex is equal bilaterally. It tells us there's no signs of growth behind there. I'm going to actually check your pupillary response. So we're looking at cranial nerve number 2. Look straight at me. Good. I'm checking its lateral, contralateral side. There's good pupillary reflex. Again, one more time. Good. So pupillary reflex is good. So cranial nerve number 2 is working. I'm going to have you follow my finger. What we're checking here is cranial nerve number 4, 3, and 6. Good. Extra eye ocular movements are intact. I'd like to have you follow this coming to your nose. Good. I saw pupillary constriction and accommodation. Can you pull down your conjunctiva for me? Good. The color is nice and it looks nice and moist. I don't see any irritation of the conjunctiva, which shows us you're not having any allergy problems. Also, no bacterial, no viral growth based on just the quick view of that. Okay, the other thing I want you to look straight at me. I'm going to check your peripherals. Let me know when a finger comes into, okay? Again? Ready? Okay, good. So peripherals there. Let's take a look at your nose here. I'm just looking at symmetrical. Can you look back or look up for me slightly? No deviation of the septum. So we're going to take a quick peek in the nose. So there is some erythema there. I don't see any polyps. And I was able to see the lower turbinate, looked okay. All right, let's take a look at your throat here. Can you swallow for me? Good, okay. Now I like to feel the thyroid from the front. If you could swallow. Good, and one more time. Good, so the trachea is midline. I wasn't able to feel the thyroid very well, which is a normal finding. I'm going to check cranial nerve number 11. Can you push up against me? Good. And then left to right with your face. Good? Good. All right, so cranial nerve 11 is intact. I'd like to take a look in your mouth here. Say ah for me. Good, and gag. Okay, so cranial nerve 9, 10, and 12 are normal. I didn't see any signs of palatine tonsil infection. I do want to look at your teeth. Can you pull down your lips in the front? Very good. Up. And say ah one more time. Let's just take a look. Okay, pull the tongue back. Let me take a look at the teeth. Good. The palate looks really good. It's nice and moist and pink. No signs of masses or growth. No abscesses in the teeth. Okay. So everything looks okay there as far as that goes. So I'm going to take a look at your back. Just looking around at your skin. Looks good. If I could take a look at your arms. Nice and warm, no discoloration. Cap refill. It's all less than 2 seconds. I don't see any signs of cyanosis. Looking for masses or lesions or moles that don't look right. That looks good. It's nice and warm. Cap refill is good. I'm going to feel your skin temperature. Equal bilateral. Cap refill is less than 2 seconds, which is a normal finding. I'm just going to take a look at your legs. No masses. No lesions. Okay, a little bit of freckling up here, and we'll look at the skin when we do the rest of the exam, okay? So I'd like to look at your spine. If you could stand up straight for me. Can you bend forward? Okay. No scoliosis, any tenderness along the spinous processes here?
No.
Okay, that looks really good. All right, I'd like to take a listen to your lungs here. I'm going to have you pull it down just to kind of keep your breasts covered. So we'll start this. Can you take a deep breath for me? Good. Nice rise bilateral there. I'm going to listen to the front. Nice deep breath, unrestricted. Good. Very good. 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 Upper and middle lobes are clear bilaterally. I didn't hear any signs of bronchi wheezing. So I'd like you to say E for me each time the stethoscope hits, okay?
E.
Good.
E.
Good.
E.
Good.
E.
Very good. So no signs of egophony, which would indicate consolidation. I'd like you to say 99 for me.
99.
Good.
99.
Good.
99.
Very good. Tactile frematus and interior is normal. Okay, so we're going to do some breathing again when you feel the stethoscope. Nice and clear. Go ahead. Very good. Very good. 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 Okay, and then same thing again. Every time the stethoscope hits, if you can say E for me. Go ahead.
E. 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 E.
Very good. No signs of egophony. Same thing. I'm going to touch your back. I'm going to have you say 99.
99.
Good.
99.
Good.
99.
Good.
99.
Good.
99.
Tactile frematus is normal. So no signs of bronchi, wheezing, problems with the respiratory. Bilateral is normal. I didn't see any signs of tracheal deviation. Color of skin looks normal. So your pulmonary system is working well. I'd like to listen to your heart. Okay. So I'm going to have you bring this down again, okay? So second intercostal space starts the aorta. S1, S2 present. Come across the sternum. Second intercostal space. Pulmonary, good. I'm going to drop down a little bit. Tricuspid, good. And then I'm going to have you lift this up and keep your breast covered for me. So mid-clavicular line, I'm listening for the point of maximal in. It's also the mitral. Okay, so point of maximal impulse is center line to the clavicular. AP tricuspid, mitral, everything was S1, S2. No signs of murmur, no S3, S4, so the heart looks good. I'm going to feel your pulses bilaterally. Good. Cap refill. Looking at the nails, no signs of discoloration, ridges. Nail health looks really good, no signs of onychomycosis. Pulses are bilateral, skin is good. I'm going to check the pulses here, posterior tibialis, good. Dorsalis pedis, good. And dorsalis pedis, good. Temperature's good. I'm looking at the toes, the skin, I don't see any cyanosis, onychomycosis. There's no signs of edema, which is good for the heart, same thing. Coloration looks good, cap refills with the normal. Pulses bilateral, upper and lower are both +2. Nice and strong, regular rhythm. All right, I'm gonna have you lay back. We're gonna do an abdominal exam. So I'm gonna have you pull this up just under your breast there. And I'm gonna pull your shorts down just enough to expose the belly. Can you take a deep breath for me? And let it out. So no signs of masses, no hernia. I do see an abdominal aorta pulse, which I'm gonna listen to while I listen to the bowel sounds right now. Lower left quadrant. Left upper quadrant. Right upper quadrant. Right lower quadrant. And I'm gonna listen for murmur on the abdominal aorta, just left of the umbilicus. No murmur present. Bowel sounds are normal, they're neither hypo or hyperactive, which is good. I'm going to palpate your belly. Let me know if you have any tenderness or problems. This is light palpation, just feeling for masses, any abnormal feeling or pain. I don't feel anything that's abnormal. I'm going to go a little deeper now. Left lower quadrant, right upper quadrant. I actually like to feel for the spleen. Do not feel the spleen. Right lower quadrant. Good. This right upper quadrant. And I'm going to actually feel for the liver. I don't feel it. Can you take a deep breath for me? And out. One more. And out. On women, I like to check for gallbladder. I'm unable to palpate the gallbladder. Was there any pain with that?
No.
Just going to feel for the kidney, the right side. Same thing on this left side. I cannot feel the kidney, so that's a normal finding. No masses present, no lesions. I don't see any scarring. Okay, the abdominal looks good. So let's move on to musculoskeletal. I'll have you sit up in bed, please. Okay, so we already checked the cranial nerves in the shoulders, but I want to check your range of motion. Can you give me some nice circles? Kind of this type of thing. Good. Wrists. Any pain? Okay, so let's actually test your strength there. I want you to bicep curl. Good. And towards me. Good. Bicep curl. Good. And towards me. Good. And let me check out making good. Flat. Good. Fingers apart. Together. Good. A-OK sign. And scissors. So I just checked the muscle strength of her arms. So we're looking at the cervical brachial plexus. It's intact. I'd like to check C8. Can you give me a nice squeeze? Bilateral, equal, and muscle strength. So the upper extremities, no pain, active or passive range of motion, good strength bilateral, so that's good. I am going to check the strength of the lower limbs. Can you kick me? Good, and pull. Good, and kick, and pull. Good. And push the gas pedal, and toes to nose. Good. Let's check it. Good. Good. Okay. So the lumbar, so we're technically looking at L5 through S2. Good strength. I'm going to check L2. Good. Good. Okay. Good strength L2. So I'd like to test sensory now. So I'm going to have you close your eyes. I'd like you to put your hands palms up for me. Good. Let me know what you feel on your hands. Okay. We're going to start with soft touch first. Here we go.
Left thumb.
Okay.
Right middle finger.
Okay.
Left middle finger. Left pinky.
Good.
Right pinky.
Good.
Right thumb.
Okay, now you're going to feel something sharp. Let me know where you feel it.
Right middle. Left middle. Left thumb.
Good.
Left pinky.
Good.
Left right pinky. Right thumb.
Okay, so sensation, the soft touch, and prick pain is normal for the median, radial, and ulnar nerves. We're going to move the feet. I'm going to have you close your eyes and let me know what you feel.
Right big toe, left big toe, left pinky, right pinky, left middle, right middle, right pinky.
Okay, soft here. Let me know what you feel.
Left big toe, right pinky,
Uh-huh.
left pinky,
Uh-huh.
left middle,
Mm-hmm.
right middle.
Okay, very good. So what we just checked is L4, L5, S1, sensations intact, both to light pressure and to prick. I'd like to actually check your reflexes here. So we're going to start with the clonus. Clonus is negative. Okay, clonus is negative. S1, S2. So just try to relax for me. Good. S1, S2. Good. Okay, so I call that a +2 based on the Achilles. Now I'm going to have you pull your hands apart. We're going to check L3, L4. Good. Good. So I call that a +2. A little hypoactive on the left, but within normal range. I'd like to check a Hoffman reflex. So try to relax your fingers. Negative Hoffman for the right arm. Negative Hoffman for the left arm. What we're looking for is a change in what's the pointer finger and the thumb here. So I'm going to check C5, C6 at the bicep. Try to relax for me. Good. Same thing on the other side. Try to relax for me. Good. All right. And then I'm going to check C7, C6, C7. Try to relax for me. I have your arm forward. All right. I'm going to have you relax. You got a little tension here. You okay? Try to relax that. Try it again. Okay, there it is. Other side. Try to relax. Good. I'm looking at the tricep here. Good. So +2 on all the deep tendon reflexes, which is good. I'd like to look at your gait. If you could stand up and walk to the chair, and then toe to ankle or toe to heel coming back. Good. Toe to ankle. Good. So gait's not abnormal. I didn't see any ataxia. All right. I'm going to have you close your eyes. I have my arms around you. I just want to observe you. Good. Negative for Rombergs. Keep your eyes closed. Good. She's able to compensate for push during standing. All right. I'm going to have you have a seat again. What I'd like you to do is check the fine motor reflexes by tapping, coming back. Good. Can you scrape your heel of this foot along the shin of this foot back up too? Okay. Good. Fine motor reflex on the legs are fine too. I'd like you to take your hand and kind of do this and try to speed it up. Good. Other side. Same thing. Good. Okay. Good job. And then what I'd like to do now is check extraocular adjustment, okay, point-to-point test. So I'd like you to touch your nose and then touch my finger. Okay? Good? One more time? Good. So you're able to compensate visually forward and backwards. And so we checked all your cranial nerves. We have intact sensations, and muscle strength is good. And that completes our exam. Thank you. Wash my hands. And that's it. Thank you.
Wow, Josiah.